Hello, and welcome to the Osteogenesis Imperfecta Foundation's podcast series. My name is Petra Harvey, and I am the Program Services Director at the Osteogenesis Imperfecta Foundation. On each podcast episode, the OI Foundation brings you information about the diagnosis and treatment of osteogenesis imperfecta, presented by an expert in the field of OI and rare bone disease. The podcasts are a part of the ongoing educational effort of the Brittle Bone Disorders Consortium, part of the National Institutes of Health Rare Disease Clinical Research Network. Throughout the podcast series, we've talked about multiple approaches to treatment for OI, including fracture care, surgery, treating the whole person, and of course, multidisciplinary care. Today, we will focus on therapeutic considerations for health and fitness for the adult with OI with Dr. Francis Baratta-Ziska, Physical Therapy Clinical Supervisor at the Hospital for Special Surgery in New York. Thank you so much for joining us today, Dr. Baratta-Ziska.
Oh, Petra, it's great to have this opportunity, and thanks for inviting me to speak with you.
Awesome. Okay, so just also want to thank you for the work that you and the team of physical and occupational therapy consultants have done to complete a newly revised brochure for therapeutic strategies. We receive a lot of questions from physical therapists working with children and their parents, as well as adults who would like a little more guidance about the strategies to develop care plans and maintain as much physical independence as possible. And as always, the OI Foundation recommends to consult with a physical or occupational therapist experienced with OI about your personal treatment plan. This podcast is made as a service to the OI community and does not serve as an endorsement of any particular plan. So let's begin with question 1. What is the role of a physical and or occupational therapist in the care plans of adults living with OI? And when is therapy typically prescribed?
Well, the PT and OT's role when developing care plans for adults living with OI, Petra, is really aimed at helping the adults living with OI get back to what they really want to be doing and optimizing their functional skills. So very often formal therapy is prescribed when an adult with OI may follow an acute phase like surgery or just had a new fracture and is immobilized, or if they are wanting to or starting to have difficulty performing some of their usual activities like getting in and out of bed or getting up and down stairs or propelling their wheelchair. So if they start to have difficulty with those activities, it's a good time to consult with the doctor and also get a prescription for PT to address why they're having difficulty with those activities and try to get them back to their functional levels that they need to do the things that they need to do, like going to work and taking care of their household, or if they're a young adult, maybe going to school. So those are typically the times when therapy is prescribed for adults with OI.
I see. That makes a lot of sense. So at conferences and in the newly revised PT guide, we often hear recommendations to incorporate elements of PT into home exercise programs and daily routines. Can you tell us why that is important and give some examples?
Sure. It is important to be active throughout the day and not just at a couple of times a week. And it's also important to integrate those activities and exercises that the therapist might give you into your daily routines so that the bodies can develop that muscle strength and that muscle endurance with periods of rest in between. And it's also because we are developing those muscle strength and endurance to do the things that we need to do. So if a person has a difficult time standing for, 5 minutes, then maybe putting in exercises while the person is standing for 10 to 30 seconds throughout the day. So such as if the person can stand up at the bathroom sink for the amount of time to brush their teeth, or if the person can stand at the kitchen sink while they pour a cup of coffee. So those are pockets of activity that can build upon the exercises that are often prescribed in physical therapy. And then another reason why it's important to incorporate these activities throughout the day rather than one big exercise session is so that we can combat that frequent complaint that adults with OI have about getting tired quick. So they have this higher fatigability. So when we do exercises in intervals or in short sessions, it builds on the muscle's endurance to do exercises and sustain a position for longer periods of time. And so that's another reason why we would recommend incorporating those exercises into daily activities. Another reason specific to people with OI is that we know that fractures can occur with repetitive movements. So we want to decrease that risk of fracture and do these recommended movements in short intervals, again, throughout the day, rather than spending a half hour at a time doing it. Does that make sense?
That does. It makes a lot of sense. So how much exercise should adults get? Is there a risk or concern for overexertion? And I guess just at what point do you say that you are or you aren't pushing yourself enough to reach the recommended amount?
Well, the American Medical Association recommends that adults in the general population exercise between 2.5 hours a week. So any way that you want to distribute that 2.5 hours throughout the week will give you the cardiovascular and cardiopulmonary benefits of exercise. That being said, we always try to educate people starting a new exercise program to consult with either the doctor and or physical therapist to make sure that the exercise program that they're doing is safe for them in terms of their posture and alignment and how they're doing the exercise so that they don't injure themselves. Posture and alignment and form during an exercise is really important to make sure that the muscles that you're targeting are the muscles that are actually doing the movement and the activation. And the other thing to remember is people with, specifically for adults with OI, that any bowing of the limbs can cause muscle imbalances and kind of change the way the muscles pull, so that the therapist's eye will also give the adult good feedback in terms of maybe modifying a certain exercise maneuver in order to optimize the muscle activation and also that prevention of injury. That's important. And then the other thing that therapists will often cue adults with OI when they're exercising is how hard to exercise, right? Mm-hmm. The intensity level. And usually we teach adults to talk through their exercises so that they become a little breathy but not out of breath. So it's 2.5 hours of moderate intensity exercise about 5 times a week. That's recommended by the American Medical Association. And moderate exercise is usually when a person can maintain a conversation but be breathy. So that would be their exertion level, and that would be online with the cardiovascular and cardiopulmonary training benefits that you would get at that intensity. And the other thing we try to educate and teach people starting a new exercise program is to start slow. If you haven't exercised in a while, then this isn't the time to get everything done in one weekend. And what happens when you do too much, too fast, too soon, is that's when you can cause an injury or even increase your risk of fracture. So another time that adults with OI could consult with a therapist, with a physical therapist, is when they want to start an exercise program. Find out from the therapist, where am I weak? Where is my posture faulty? How can I safely improve in these areas? And so together, the person with OI and the therapist can develop a exercise program that's safest for that person, and also to make sure safest in terms of not hurting themselves during the activity. And they might see each other just for a short period of time, maybe 6 or 8 weeks, until the person with OI develops a good routine at doing their own program on their own. And then maybe that relationship will just touch base every 3 to 6 months in order to update the program safely. And so that's another way that a therapist can be involved with people living with OI in terms of um, bringing, making a new exercise program and keeping it safe for the person. I think I answered all those, right?
You did. That's great information.
Right? I'm trying to find my spot.
That's great information. Thank you so much. So we also recorded a podcast about safe therapeutic strategies for children with OI. As a physical therapist that works with children and adults with OI, are there similarities that you notice in developing treatment plans for both populations? And do you think there are more similarities between types of OI or age, or what are your thoughts on that?
So similarities that I noticed when we develop treatment plans for both children and adults living with OI is that exercise programs are most successful and people will stick to them if they are made with the individual's specific needs incorporated into them. So if a person is not able to get to a gym, then devising an exercise program that involves gym equipment would just not be successful. So really asking the child, the family, or the adult living with OI, what is it that you really need to get back to doing? And then together with the therapist, you'll devise strategies to get to that goal. So if the child's goal is to be able to climb the 4 buses onto the school bus in order to go on class trips, then that would be a goal during therapy. And if the adult living with OI's goal is to take the crosstown bus in order to go to the west side, then that would be a goal in therapy. So it's always important for the therapist and the person living with OI to find out what it is that the person really wants to be able to do, and then work on that plan of care. So that's a similarity. Always being very patient-centered and individual with plan of care. And are there similarities between types of OI rather than age? Well, there are similarities between types of OI in the sense that the programs need to be don't have these twisting movements, and also need to be mindful of what the person's bone density and fracture history is before we make recommendations for exercises. And that goes for children and adults living with OI. And the other thing that we are mindful of is how the posture and alignment of both children and the caregiver and the adult living with OI, how their posture and alignment is in sitting and standing and in different settings, like at a workstation or at school or in the car. So frequently the therapist will work with the person on maximizing what their posture and alignment is, because good posture and alignment helps to make muscle function more efficient and hopefully decrease the risk of injury, decrease the risk of fracture, and just make the work that needs to be done more efficient and less fatigable.
Definitely. Yeah, this is all really, really helpful information. And I think that, we've covered a lot in this conversation. If you have any questions, talking to the listeners, of course, if you have any questions, please feel free to email bonelink@oif.org, or call the OIF office at 301-947-0083. And again, please make sure to look at the newly revised PT guide that Dr. Baratta-Ziska and a team of other consultants worked so hard to make sure that that important brochure was completed. So thank you again, Dr. Baratta-Ziska, for joining us today.
Petra, it was my pleasure. Thank you for having me.
Okay, awesome. We'll be back next month for another podcast. Make sure you tune in.
Bye.